Hello, everyone. A very good evening, everybody. I'm Priyanjali from Bladder Wellness team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, CA prostate. Prostate cancer occurs in the prostate gland, which is located just below the bladder in males and surrounds the top portion of the tube that drains urine from the bladder. Prostate cancer is the most common cancer in men after skin cancer. It grows very slowly, and the chance of getting prostate cancer goes up as men gets older. To throw more light on the subject and guide us on what's right for diagnosis and treatment of prostate cancer, today we have with us renowned urologist Dr. Feroz Mohammed Khan. He holds a degree of M.CH MS Urology from CMC Vellore, and he is the consultant urologist in Sahara Hospital Lucknow. Dr. Feroz Mohammed Khan has rich experience in the field of urology. Sir is one of the best urologists in Lucknow and carries out the treatments with utmost precision and efficiency, ensuring that the patient health is in safe hands. A very good evening, sir, and we welcome you to today's platform. Our first question, doctor, for you would be, what is prostate gland and why is it necessary to maintain its health?
Yeah. Welcome you all. Thank you very much for um, giving me this opportunity to join the session. About the prostate gland. So, prostate gland basically is a gland, is an organ which is found only in men, and it is, as you said, it is located just below the bladder, urinary bladder, and it surrounds the urine passage, and it produces a fluid which is a part of semen, which is important for fertility. And
Right.
the importance of maintaining the health of prostate is that, as we all know, that a person, when a person ages, this prostate gland physiologically increases in size, and it allows a compression towards the urine passage. So that there is a difficulty in passing urine, and patients develop certain symptoms which we will discuss later on. Along with that, there is an important thing which everybody concerns about is the prostate cancer. So some men, they develop, unfortunately, prostate cancer also. So we should be always very aware of this problem, and how to treat and how to consult the physician or the urologist regarding that. That is why it is important.
Right. So, doctor, what are the risk factors of this disease?
Um, Basically, we don't know exactly what are the risk factors, as on case by case basis. But which what we know is, uh, dietary factor is important. Like, if a person is taking more of fat, especially the animal fat, that has been seen that it causes prostate cancer. Along with that, smoking, that is one thing which also increases the risk of developing a prostate cancer. And that is why healthy lifestyle is very important. And the dietary balanced diet should be included by every person in their lifestyle. They should not take sort of proteins, animal proteins, especially animal fat also. That these are the things which basically causes prostate cancer.
Right. So, doctor, what are the common symptoms of prostate cancer?
Basically, prostate cancer doesn't have, in the early stages, doesn't have a separate symptoms which we can distinguish it from other prostatic problems. So when the prostate enlarges in size, as I already said, that increases the pressure over the urinary passage. So patient may develop certain symptoms, which is common to all the prostatic conditions. That is like increase in frequency of urination, decrease or thinning of the stream of urination. Sometimes they feel urgency that they have to go immediately to pass urine. Nighttime they have to wake up and pass urine. Sometimes these patients have blood in semen, and as well as these are the early symptoms, which is common to all enlargement of prostate, that is we call BPH, as well as inflammation or infection to the prostate gland. Similarly, in prostate cancer, also in the early stages. But in advanced stage of prostate cancer, when the prostate cancer goes to the bones, in those scenarios, these patients develop decrease their weight, their appetite is decreased. They have very specific symptoms that is called multiple joint bony pain, especially at the time of sleep. So these are bony pains in the multiple bones, especially at the time of night, is the very specific symptoms of prostate cancer in advanced stages.
Right. So, doctor, can this cancer be caused by genetic factors anyhow?
Yes, basically, prostate cancer develops in patients in older age group. So above 65 years is a very common age where this prostate cancer develops after age
Mhm.
65 years of age. Similarly, it has been seen that it has a familiar risk also. Like if there is a family person, like father, grandfather, or maternal sides, somebody has prostate cancer, then there is always a risk of having a prostate cancer in the offspring. So in those scenarios, these patients who have a family history, positive family history, they should be screened, they should be evaluated at an early age, like 50 years of age and beyond that.
Right. So, anyhow, we are saying that our members, our family members might be at risk. So, what can be their role to play at this very moment if they are thinking that they also can be at risk?
Yes. So if there is a family history of prostate cancer, like they have been diagnosed, family person like father, mother, father, grandfather, or grand maternal sides, somebody has been diagnosed with the prostate cancer. So in the offsprings, like a male person who is around 50 years, 45 years, they should go consult to the urologist. They should be evaluated on a physical examination that is called a rectal examination, this digital rectal examination. That is one part. Along with that, there is a blood test, which is known as PSA test. So these two tests basically throws a light onto the condition scenario. If there is any suspicion of nodule in the prostate gland on examination, as well as if there is a rise in PSA, based on that, we need to further evaluate those persons based on CT scans, some MRIs, and PET scans also.
Right. So, doctor, as we are speaking about the diagnosis options, can you please also elaborate about the treatment options available for prostate cancer?
Yeah. So prostate cancer, a person who has developed prostate cancer or any family member, they should know. Well, the first important thing is that they should not get worried about it. That a good treatment is available for prostate cancer, especially in the early stages when the prostate cancer is limited to the prostate glands. So, as I said, they should not be worried. They should immediately consult to a urologist and get the evaluation tests done to certain the stage of the prostate cancer. So, if it is in the stage one, depending on that, there are treatments like radical prostate surgery. In that case, we remove the prostate gland, the total gland of the prostate, along with some lymph nodes. The second treatment is the radiotherapy, the सिकाई जिसको हम कहते हैं एक layman language में. So radiotherapy is another treatment. Apart from that, some chemotherapy, some other hormone drugs are available. So the treatment is there, definitely. And also in cases of advanced prostate cancer, where the prostate cancer has been spread from the prostate gland and reaching to the multiple bones, in that scenario, there are hormones, there are some medications, and along with that, chemotherapy is also there. So there is this field is evolving on a day-to-day basis. Very promising branch, very promising. Lot of research is going on in this treatment, and if we talk about the surgery of the prostate gland, so we have open surgery, we have laparoscopic removal of the prostate gland, and now the newer treatment, that is a robotic surgery, that is also available in Lucknow in our Sahara Hospital. Along with that, some other hospitals they also have. So with the precision, with the very lesser and lesser side effects, we can do the surgeries. Thank you.
Right. So, doctor, I think this all the viewers who are watching us right now would be wondering this: can prostate cancer be prevented anyhow?
Uh, what I can say is there are three things which everybody should like is a general condition we can like apply to all the medical problems. And these things we should be doing, like healthy lifestyle, good physical activity, balanced diet, especially low fat and low protein diet, and quitting of smoking, alcohol. These are the things if a person is doing, and we should promote all these things with healthy habits, we can say, to prevent any type of cancer, not specific to prostate cancer.
Right. So, also, doctor, we would want to know that how can one keep themselves healthy as much as possible during the treatment procedure?
Uh, First thing is that treatment should be started on time, and they have to be on a regular follow-up, regular checkups. Along with that, the family person has a greater role. Family people, they have a very major role in uh, giving the person support, family support. With that, they feel very like mindset is, they have a positive mindset. They should encourage, the family person should encourage that person that he is fine, he will be cured, he will be treated properly. So this is how we can manage.
Right. So, doctor, is there any chance of prostate cancer coming back once treated? And are there any symptoms which anyone should keep a watch on?
If a person has an early stage prostate cancer and he has been treated for on a purpose of cure, like radical prostate surgery or a radiation therapy, they, all these patients, they have been, should be keep on a follow up, in a very regular follow up, especially in early stages, monthly, then 3 months, second 2 monthly, and then 3 monthly, and then 6 and 1 yearly. So at any stage, if they develop a recurrence of the disease, it is being picked up by PSA tests, by early CT scan and MRI tests. So if any signs of recurrence is there, those recurrences can be treated well on time.
Right. I can see our viewers are engaging a lot today. We have a few questions coming up from the viewers. Abhishek Sen asks, what is the role of genetic factors in prostate cancer? And should I consider genetic testing?
No, for a general purpose, genetic testing is not required. In prostate cancer, which we have seen is, if there is a family history, and the person who needs a checkup, an early diagnosis, if he's 40 years, 45 years, and or above, then he should consult to the urologist and get his physical examination done and the PSA test. That is all required.
Right. Well, I believe, Abhishek, you have got your answer already. We have the next question coming from Ajit Singh, who asks, what treatment options are available for prostate cancer and what are the potential side effects?
Yeah. So as I already discussed about the treatment of prostate cancer in early stages, like surgery. Surgery is also of three types of surgeries: open surgery, laparoscopic surgery, and the robotic surgery of the prostate gland. In that scenario, we remove all the whole prostate gland, and then we join the urinary bladder with the urine passage. So that is called radical prostatectomy. That is one treatment. Second treatment is radiation therapy, and the third is the chemotherapy plus radiation therapy as well as hormone therapy. So, like surgeries also have some side effects, like these patients may develop leakage of urine. That is temporary thing. It recovers over a period of time. These patients, they develop impotence, and the fertility thing is gone with the radical surgery, but potency they may gain later on. And if not, there are some medications, certain medications are available for that. Similarly, radiation therapy, because radiation is focused to the prostate, but it spreads to the nearby structures like urinary bladder, rectum, the fecal passage where the fecal matter comes out. So those areas also get irradiated with the radiation therapy. So they might have some symptoms of difficulty in early frequency in urination, sometimes blood in urine or blood in fecal matter also. So definitely all these surgeries, all the treatments, they have some side effects also. But with the advancement of treatment, these side effects are becoming lesser and lesser now.
Right. Doctor, the next question comes from Amit Singh, who asks, can you explain the different stages of prostate cancer and their implications for treatment?
Yes. So the treatment, the first treatment and the second, which I discussed, that is the radical surgeries as well as the radiation therapy. So radical surgery is only indicated in first stage prostate cancer. So prostate cancer has four stages. Stage one, that is the earliest prostate cancer, where the tumor is localized to the prostate gland only. Then second stage prostate cancer, where it spreads just outside the prostate capsule, and it involves the near adjacent structures like seminal vesicles, bladder neck, and the some nearby. And the third stage prostate cancer, where it goes to the lymph nodes, to the body's nearby lymph nodes. And in stage four, it reaches to the bones, especially, as well as it may go to the liver, to the lung also. So these are stages.
Right.
So in early stage, this is the treatment of radical surgery and sometimes radiation therapy also. In stage three and stage four, there is no surgical treatment like no radical prostate removal, but radiation therapy can be given to local focal areas where the patient is having severe bony symptoms. And the hormone treatment is the mainstay. The hormone treatment, as well as some medications and chemotherapy for advanced stage prostate cancer.
Right. Doctor, the next question comes from Adit Srivastava, who asks, what are the risk factors associated with prostate cancer and how can I access my own risk?
I think we have answered this question in
Right.
the beginning, that risk factors, there is like unhealthy diet. So balanced diet is very important, especially lesser and lesser of the animal fat intake, along with the smoking, that is another bad habits, and sedentary lifestyle, increasing in weight, body weight, so obesity. These are the risk factors. And like as I said, if somebody who doesn't have any family history of prostate cancer, he should not be worried. If he wants screening, the screening starts at around the 60 years of age. Or if the patient is having symptoms of difficulty in passing urine, any symptoms which is related to the prostatic enlargement, at that time he may can have an ask the physician or the urologist to get the PSA test done. But
Right.
not all
Doctor,
every patient.
yes. So, doctor, as we also know that stress has got to do a lot with most of the diseases which we are facing nowadays. So, does stress has a role in prostate or prostate related issues or prostate cancer as well?
Specifically, I can't say, but yeah, it has been seen that this stress affects a lot of organs of the body, our disease process also. But for the specific prostate cancer, I can't say about that.
Right. We'll quickly move on to the next question, which comes from Deepak Saxena, who asks, are there any quite similar to the previous question or maybe the answer you have given already? Deepak Saxena asks, are there any lifestyle changes or dietary recommendations that can help in preventing or managing prostate cancer?
So, like healthy lifestyle, that is one thing. Smoking, if a person is is doing a smoking, he should quit the smoking. Positive mind attitude and healthy lifestyle, balanced diet. Yeah, these are the things.
Also, doctor, we know that water is the source of life. Uh, what is the normal, just even if the person is not suffering from prostate related issues, what is the normal intake of water which everyone should at least have in any sort of weather conditions? What is the normal water intake?
In general terms, we can say 8 to 10 or 10 to 12 glasses of water is enough for a
Right.
normal healthy person. But like if person the season, it varies with seasons. If in winter seasons we don't have any sweating issues,
Hmm.
and so in that scenario we can reduce the water intake. Similarly, if in summer seasons where a lot of sweating is there, and in that scenario we have to increase the water intake. So, and another aspect of checking that water consumption is adequate or not is the color of urine. So in daytime, if the color of urine is dark, it means our water intake is less. If it is clear, no color is there of the urine, it means our water intake is adequate. So that is one parameter of checking whether water intake is sufficient or not.
So, doctor, when a patient is suffering with prostate related issues, is there any changes in water intake as well, which normally you suggest?
If a person is having a prostate problem, like he's having increased frequency and urgency, in that scenario, he has to decrease the water intake, and especially in the evening hours. Like when a person sleeps at 10 o'clock, he should start reducing his water intake from 5 o'clock or 6 o'clock time, and he should not take much water at the time of when he goes to bed. So that is one way he can reduce his nighttime frequency, which disturbs the sleep.
Right. Doctor, what about alcohol? Is there any way of avoiding, or would you suggest the patients to avoid that as well?
No, for prostate cancer, there is nothing, no recommendation like reducing the alcohol intake. But yes, uh, excess amount of alcohol intake or excess amount of anything, I can say in general terms, which is not good for health. So
Right.
anything which is excess is not good for health in a general language.
Right. Well, we'll move on to the next question, which comes from Arun Sharma, who asks, "What is prostate cancer? How is prostate cancer diagnosed, and how do the test results mean?
Yeah.
What do the test results mean, or can we say that?"
So prostate cancer, I have already discussed. So prostate cancer is a cancer which develops in the prostate gland, and it affects older age people, and it also has a family history. Like a person is having family history of in a family person is having a prostate cancer, he is also at risk of having prostate cancer. If anybody suspected to have of urinary symptoms who is having a family history of prostate cancer, you should go to urologist, consult a urologist, get the physical examination done, that is rectal examination, to check for any nodule or any suspicious lesion in the prostate gland. That is one thing. Second is the blood test, which is the PSA test, very sensitive test. If PSA is on a raise, is more than normal levels, and there is suspicion of nodule on the rectal examination, he should further be evaluated with CT scan, then MRI, and biopsy also of the prostate gland. This is the
Well, doctor, you have already mentioned in your earlier answers that having a healthy lifestyle is very much important. Uh, to have a proper exercise routine in your everyday basis is also important. So nowadays we get to see that the generation is very much health conscious, and kahin na kahin usi chakkar mein they take some over the counter medications maybe. So is does that affect anyhow? Is that any way related to prostate cancer?
no, I don't think so. I don't think so. But yeah, having a good healthy lifestyle is very good. Over the counter of medication should be avoided. Whatever, if a person needs any treatment, any medication, it's good to consult his physician, his any doctor, surgeon, or urologist. But you should not take medications over the counter for all the symptoms. Yeah, cough and cold is fine. Fever, that's fine. But beyond that, over the counter medication should not be uh, promoted.
So, doctor, what about excessive protein intake, which is also a trend nowadays? Does that any effect? Like, does there any way to it? I mean, any role of or excessive protein intake with prostate related problems?
No, no, no. Prostate related problem, it is not. But yeah, excessive protein intake is not good, especially the this protein powders and all should be discouraged. Whatever protein is needs to be taken should be dietary protein. That is the best way to take.
Okay. So, doctor, I believe that was a very, very informative session with you all, with our viewers, and of course, you today. Before we leave, any take home note for our viewers who are watching us right now?
What I can say is a prostate cancer is a definitely cancer word is very it makes the people anxious, but we should not be worried. Prostate cancer is not life-threatening in all the cases, and especially in the early stages. So prostate cancer can be cured, even if it is being diagnosed at a very later stage, advanced stage. There are treatments available. Cure is not possible at that time. That is true, but patient can be managed safely for a longer period of time. And most of the time, these patients who have advanced prostate cancer, they don't die because of the cancer. And if it is managed well, they may die because of other problems like heart problems, liver or lung problems. And they've been very well treated with the advanced treatment of prostate cancer.
Okay. That was Dr. Feroz Mohammed Khan for us. Thank you so much, Doctor, once again for your valuable time. It has been
Thank you.
quite an informative session for our viewers today, and we look forward to many more such sessions in the coming time. And thank you, viewers, for your excellent participation. For more information and updates, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you.
Thank you.
Have a great evening, and of course, stay safe. Thank you so much,
Thank you.
everybody.
Thank you very much.